Hello and welcome back to another episode of the Health Talks. I'm Dr. Shahad Mohammed Abulanain and I'm the host of the podcast. With modern lifestyles becoming increasingly sedentary and with more people experiencing back pain, posture-related problems and joint degeneration at younger ages, awareness about orthopedic health has never been more important. In today's episode, we'll be discussing joint health, mobility, spine health, sports injuries, and the latest advancements in modern orthopedic care, including minimally invasive procedures, robotic-assisted joint replacement, and regenerative medicine. And to help us understand this better, I'm joined by Dr. Rajesh Garg, specialist orthopedic surgeon at Thumbay University Hospital and who holds 25 years of experience in joint replacement surgeries as well as sports-related injuries. Welcome, Dr. Garg, and thank you very much for being here with me today.
Thank you for having me here and giving me this opportunity to talk about such a vast topic. And let's see how it goes and what we can tell our listeners about how to keep their bones and joints healthy.
It's a pleasure having you, Doctor.
Thank you.
Dr. Garg, when we start talking about joint health and mobility, we often hear those terms. What does that actually mean?
So when we talk about joint health and mobility, so joints are basically part of your body where two bones are connecting with each other,
right.
And that's what we call as joint. So it can be a hip joint or a knee joint. So it's not only the bone which is forming the joint, it is also your surrounding muscles which are controlling the movement. They are the ligaments which is connecting from one bone to another bone, and in between these two bones which is forming the joint, there is a cover which is called as cartilage. There is a fluid secreted inside the joints which provides lubrication and kind of a food for the joint. So all together you can understand like there are so many things which is forming your joint. So everything has to be healthy, everything has to be normal to give you a perfectly normal healthy joint. And if everything is working normally, then you have a very good pain-free mobility. So having said that, means a healthy joint means a pain-free, without any swelling, without any problems, and free movements. So
right.
That's what called as mobility, and of course with stability also.
Right, and how do maintaining good mobility and joint health improve patients' quality of life?
So if we start like from a younger age, a person who is having a very good bones and joint health, somebody who is not overweight, somebody who has been totally risk-free, doesn't have any kind of injuries or anything, definitely for surely his joint is going to go a longer way. Vis-a-vis if you compare to somebody who has not been taking care of their bone and joints, and there have been some kind of injuries which they have not taken care of, and somebody who has not been on balanced diet, somebody who has been overweight, you can understand logically he is going to have a more wear and tear. So definitely his joint and bones are going to be unhealthy, and surely he will end up in some kind of orthopedic issues sooner than later.
Right, and Dr. Garg, from your experience, do you usually see that people pay attention to their joint health a little bit too late?
Yeah, of course we see that, and having practicing for last 25 years, we have been noticing like people do approach to their doctors, and nowadays in this century we can see that people treat Google or artificial intelligence more like their doctors than doctors as such.
Right.
So we surely do see patients coming very late in the late stages when they have tried all the things, all the Google and AI and even the home remedies. I'm not saying that one should not use all those things. It's good to use, but there is a limit, and there you have to be always cautious when you are taking help from internet. And definitely when the treatment, things which can be prevented with some form of medication or with some help from physiotherapy, and if you have not approached to your doctor at the right stage, this can be very dangerous and can finally lead up to a surgery. Right. So of course we see people who are coming at very late stages of the treatment.
Artificial intelligence and home remedies should never replace a doctor's advice. So we should encourage patients, yes, to use technology wisely, but always seek guidance from the doctor.
Surely, we see these are educative tools.
Right.
I always understand, like any kind of problems, whether it's bone or a cardiovascular or a GI problem, anything, education is the key. So our patients nowadays, they are very educated. I will say now they are there, they ask questions. Like gone are the days when I was practicing, let's say 20 years back, whatever you tell the patient and they have taken it as a Bible truth, you know. But nowadays they are educated, they are questioning you, they are asking you why this, why that, and it makes you feel nice that. And sometimes you are also like, you know, like stressed, like you have to explain it to the patient, and if they understand what exactly they are suffering from and what is the treatment, I think it goes a long way for the benefit of the patients.
Definitely, doctor. Awareness is very, very important. From your experience, what are the common causes now of joint pain that people usually come complaining of?
So it totally depends upon, I feel that a lot of things depend upon the age factor also. So now if we talk about a younger age, we do get patients at younger age when if they have some genetic congenital issues which they have not taken care of over a period when they are growing from their adolescent to the early adult age. Those bones and joints may be deformed, the cartilage, the muscles which have not been developed properly, which if in their childhood, if they would have taken care, these problems would not have occurred. So we can say that some congenital issues which are not very common, and in adolescent age when people, now we are in UAE, it's a sports country, we do get people playing football, we get people playing basketball, we get people playing cricket, and I have seen that it's a very division, nationwide division or community wide division. So we do get a lot of our Arabic population who have football injuries, we get Asian population with basketball and cricket injuries. Now sometimes what happens is most of these players what we see are amateurs, or they don't have any help at the field, or they don't have any emergency doctor or a physiotherapist available then and there, and then they don't treat it properly at that point and they continue playing, or they just go home and rest, and then finally after some pain and swelling goes away, they go back to their field, and the joint which is already injured, let's say some percentage, and they hog it again, and then the injury become more severe. So we see more kind of sports injuries at the younger age, but as one progresses in age, now like everybody has to grow old, we cannot stop that, and what happens is our hair is going to gray, we are going to see less from the eyes, our muscles are going to become weak. Similarly, all our joints, there is wear and tear is happening. Million of times we are using that joints, your hip joint, your knee joint, your ankle joint. We are doing folding, bending, sitting on the floor, running, and if you are into sports, you can imagine the amount of stress and strain these joints are undergoing. So over a period of age like 40, 50, 60 years of age, these wear and tear start becoming, leading to arthritis of the joint. So we do see at different age younger patients with more of sports injuries, ligament injury and cartilage injuries, and at older population we see more of arthritis. Now these are like the primary kind. Now somebody who is already suffering from some kind of genetic disorders or autoimmune disorders like rheumatoid arthritis or some other connective tissue disorders. So we can see arthritis of the joints at an early age also if somebody is suffering from these kind of disease. So we have seen joint bones totally wear and tear, stage 4 of arthritis at an age of let's say 30 or 40 years of age also.
Right, thank you very much, doctor, very
My pleasure.
informative. How can a patient know if that joint pain is normal pain from playing too hard at the gym, or taking a long run, or just a heavy work day, from like a serious problem that needs immediate help from a doctor? How can a patient differentiate between the pain?
Yeah, so see, there is no, in the medical field, I feel there is nothing black and white, everything is in the gray area. So now somebody who has a sports injury, let's say, and he was on the field and he had some, he has fallen down and he has a pain and swelling, I will not say that he should directly run to an orthopedic doctor because he has a pain and swelling.
Right.
Now, of course, if in the field they have some kind of a support system, icing and then some amount of rest and a painkiller, and wait and watch for 2-3 days. If you feel that pain and swelling has not gone, and if you are not able to stand on your leg, if you are not able to go back to your sports after some days, your pain and swelling has increased, your stiffness is increasing, of course you should now go to an orthopedic doctor. But that comes only like with the joint. But of course, if you have fallen down, there is a fracture or something, you should go to an ER immediately for that.
Definitely.
Now, when it comes to the old age, now patient who is suffering from a knee arthritis, which is an early stage, they may just feel that, okay, we were able to go on our walks, we were able to play with our grandchildren, but now something is restricting us, some pain in our knee joint, some swelling in our knee joint is restricting us. We have been taking painkillers, and if they are not able to get away with that pain, and that painkiller taking frequency has been increasing rapidly, and they have to ingest that painkillers on a daily basis just to get away with that pain. So that is the time that you should approach to a doctor for an early diagnosis. And surely with an early diagnosis, and there are so many treatments available, and of course they can prevent to undergo a surgery or something. So it depends totally, like the bottom line is a pain which is not getting controlled, non-traumatic pain which is not getting controlled with some amount of painkillers, and it has been progressing, and it is associated with some kind of inflammation and swelling over the joint, one should approach to a doctor.
Amazing. So persistent, unresolved pain, not responding to any medications, immediately seek medical attention.
Definitely. And having said that, when we say medication, that doesn't mean they should be taking some kind of strong painkillers. I just mean a safe painkillers like paracetamol or something. And if they are not getting away with it, it's always better to approach to a doctor.
Thank you very much for outlining it very clearly, Dr. Garg. Now, what are the consequences of untreated joint problems? What complications can arise?
Oh, that can be really crazy. That can be really like horrendous problems we have seen. Now, patients who have, like, let's say, again I will say from a younger perspective, from the young age perspective, somebody who has a sports injury and they just had, let's say, a ligament sprain. A sprain means the ligament was just broken, let's say 50%, and they have not taken the right treatment, they have not protected the ligament, and they continue playing. That can become a full tear, and ultimately then it will lead to more pain, instability, and then it will end up in a surgery. So it totally depends upon now what kind of injury was there, what kind of problem was there in the joint, and if they have not taken the right treatment early in the stage, then of course it will be more of a problem then.
Right. And doctor, you've touched on arthritis being seen in older age group. Do you see arthritis affecting younger populations as well, or is it a disease of older age, let's say?
I will say it's a disease of an older age, but that doesn't mean we don't see patients with arthritis at a younger age. As said, that people who are suffering from some kind of autoimmune disorders like a rheumatoid arthritis, these are genetic disorders, connective tissue disorders, which is affecting your bone and joint health, which is affecting your muscles, which is affecting your ligaments. So definitely these are not letting your joints function normally. So they will have a secondary osteoarthritis at an early age. Somebody who is into sports, they have not taken care of, let's say, for example, a knee joint injury, and somebody who has a ligament tear, a cruciate ligament tear or a meniscal tear, if they have not taken treatment early and they continue with their sports activity, it will lead to an early arthritis. Nowadays, with the, you can say, like with the sports being progressive, with so many other diseases getting into our life, so we are seeing early arthritis more commonly than not.
Right. And are there other factors that increase the risk of arthritis in younger populations?
Yeah, so as I said, like connective tissue disorder, autoimmune disorder, post-traumatic sports injuries, all these are factors which can lead to an early arthritis if not taken care.
Right. So the message is to take care of your bone health and joint health irrespective of your age.
Definitely, definitely. So these gone are the days when we are talking about that your joints are going to wear off only when you become 50s or 60s. Nowadays we are seeing patients at the age of as early as 25, 35, and they are suffering from lot of joint issues.
Right, and Dr. Garg, you're specialized in sports injuries. What
Sure.
are the common injuries that you've seen in day to day?
So it totally depends upon, I feel what I have been practicing from last 10 years now in UAE, and because this is an expat country, and I have seen our joint problems are divided. Now people, the Arabic population, 90% of them comes with football injuries, and these football injuries are either ankle or the knee injuries, more commonly than the knee injuries, and then they will have a cruciate tear, they will have a meniscal tear. And then it comes to our Asian population, Philippines, Indian, Pakistanis, where we see a lot of basketball players and the cricket players. So there we are seeing more, when it comes to cricket, we see more of shoulder injuries. We see shoulder dislocations, rotator cuff tears, and then in basketball players we see tendo-Achilles tear or ankle joint problems. So it's very categorically I have been seeing, like, okay, if a patient is in Asian population and is coming with this history, then automatically I come to know, okay, this problem will be there in this patient.
So there's
So
like a cultural element in it.
definitely there is a cultural element to that, and it totally depends upon what kind of sports they have been playing, you know.
Right.
So and mainly we see the knee injuries and ankle injuries and shoulders, which are more related and more common in sports injuries.
Right, and how does delaying treatment or seeking advice late affect their quality of life or long-term outcome when it comes to sport injuries?
So when it comes to sports injury, initially, because now somebody who is into a professional player, whether it's football, basketball or cricket, the first and foremost important thing, his social life, he will be like really depressive, you know, because he is into professional player, and now he cannot do that. And so if he would have taken treatment at early stages, he would have been back to his season at an early stage. Now if he has not taken the treatment, and definitely whether it's a shoulder or a knee injury, it will slowly lead to arthritis, because these joints are made to work in a synchronized way. A particular ligament is acting on that joint to control in a proper degree of the movements. These all are high impact sports. They involve lot of movements, lot of rapid sudden jerky movements. So these ligaments are very important to provide stability and provide a very good mobility when they are running, when they are rapidly jerking from one place to another. So if they are not taken care of, those ligaments, then it will ultimately lead to arthritis. Initially they may feel some kind of instability when they are running, and they may have frequent fall when they are running, and then slowly, because the joint was not stable, it is rubbing over each other, wear and tear starts, and ultimately it will lead to arthritis. And
Right.
then there is no looking back, you know.
So timely treatment of any injury is very important
Yep.
to improve long-term quality of life and being able to go back to a normal routine.
Definitely.
Right. Now, doctor, back and neck pain are like the epidemic of the century,
Yeah.
especially with the increased use of technology and prolonged sitting, office job. How can people protect their neck and spine from that excruciating pain?
As you said, these are like type A personality disorders. Now everybody here, we all have a type A personality. We are hardly have any time from our this type A jobs. We are just sitting in our car, AC rooms, and we are going to your office. You are sitting for 8 to 10 hours continuously, either on the computer, or for us, like being doctors, we are also sitting on the chair examining patient, or we are standing in the operation theater continuously with our neck down and continuously operating for 4 or 5 hours. So these are the very, as rightly said, this is an epidemic. We are seeing so many younger populations suffering from these kind of neck pain and back pains. What is happening exactly, one should understand now. What is happening is neck and lower back, they also have, like, they are small joints in these spine, which helps in the various movements of your lower back and the neck, even the rotations and everything. These are controlled by the muscles surrounding your neck and the back. Now, somebody is just have a sedentary lifestyle, okay, like I said, we are continuously sitting. Now, sedentary lifestyle, the muscles are fatigued, muscles are atonic, they are not working properly. Now, all the load is going to go on those small joints. Now, these joints, because they are not made to overwork like this, because the muscles are supposed to provide them flexibility and endurance. Now, your muscle is atonic, so the load is on the joints. They become wear and tear, as in the knee and hip joint. These small joints also become wear and tear, and then it leads to spondylosis. And then it leads to chronic fatigue, back pain syndrome, or neck pain syndromes. So, one should always, like, you have to undergo, you can say, like, they have to be proper exercise, they have to be the flexibility is the key, endurance is the key.
What habits can people adopt to maintain healthy spine health?
So, a continuous well-balanced exercises, a well-balanced diet, and nowadays I keep telling people flexibility. I'm not saying that one should go to a gym to do a powerlifting or a weightlifting and become a Hulk or something, but somebody should be very flexible, and endurance, which can be very well provided by yoga and swimming, regular cardiovascular exercises. This will provide a very good tone and endurance to your muscles, which will put less pressure on your lower back, and they will have a very good back, and then they can, like, survive without any neck pain. So, we always suggest that if you have a long working hours, every 40-45 minutes one should get up and do those gentle stretching exercises for your neck and back, and then you can go back to your work, and hardly takes maybe 2 to 3 minutes, and it goes a long way after that.
Amazing. Thank you very much for that great advice, Dr. Garg. Now, every other person nearly we meet today has some disc problem. I've heard that a lot from different populations, young, a little bit older to elderly. What does herniated discs actually mean, and how important is getting it treated?
So, when I say a herniated disc, just a little medical terminology here. So, actually there are 4 stages of a disc prolapse. So, what happens is, we should understand, now this disc, our whole spine from top, from your head to the bottom of your tailbone, they are made up of multiple small vertebrae. These are the small bones. In between each bone, the other bone, there is a small soft cushion like structure, which we called as a disc. Now, these are, like, as I said, it's a cushion. So, it's a weight bearing. When we are jumping, when you are bending, these act like a cushion, a spongy structure which absorbs all the shock. Now, these cushions are totally under pressure. Even when we are sitting, our head weight, our body weight, it is under stress, it is under compression, and when we get up, they recoil back. Okay, so this is like kind of like a sponge which work as. Now, these spongy things, they have a fibrous layer outside and a jelly like a jam inside the disc. Now, this jam is compressed and recoil back, compress and recoil back, but this fibers, they control the jelly so that it doesn't spread out. Okay. Now, what happens in an herniated disc? Now, suppose the pressure inside, for whatever reasons, the pressure inside the jelly becomes more and more, then this fibers is going to start coming out. Then we call it as a bulge. Then if the fibers break and the jelly still not coming out, we go to protrusion. Then we go to extrusion and sequestration if the jelly is completely bursted and the jelly flows out in the canal. So, it goes to the extruded. So, there are 4 stages: bulge, protrusion, extrusion and sequestration of the disc. In a common man, all these are disc herniation. Okay. So, then it totally depends upon what stage we are in, and it doesn't matter. Sometimes we do an MRI just for a back pain and there is an incidental finding of a disc protrusion, which is stage 2, but patient doesn't have that much of a problem. So, there can be an incidental finding. All disc herniated doesn't require treatment. So, it's not the MRI what we treat. MRI just help us in staging the disc herniation. Now, it totally depends upon the patient's symptoms, how bad or is it related to that disc. It can just be an incidental finding. The back pain can be just because of the joint problem, because the joint has worn out, or the back pain can be just because of the muscle problem, and the MRI is just showing a disc which is not even related to your back pain.
Right, and doctor, are there risk factors that cause people to develop such conditions even at a younger age?
Yeah, some kind of injury, traumatic disc herniation, or somebody who is falling from height can have a sudden acute disc prolapse. Somebody, as we were discussing, sports injuries, because there are a lot of sports which involve lot of repetitive bending and getting up, bending and getting up, which can put a lot of pressure on your back. Again, it can lead to a disc herniation.
Right, thank you very much for explaining it very clearly, Dr. Garg, and in simple terms, it's much clearer now.
It's indeed my pleasure.
Now, doctor, you're specialized in robotic surgery and computer-navigated joint replacements.
Yeah.
What does it actually involve, and how did this new technology replace traditional methods and improved outcomes?
It's a very good question. First thing is, when we talk about robot, I feel common men feel that there will be a robot which will be standing in the operation theater and the robot will be doing a surgery. So it's totally a myth. Now what happens is, it's a traditional surgery, okay. So when we talk about joint replacement, I feel a experienced surgeon is a must, okay. So it's not the robot who is going to replace your surgeon and the robot is going to do a surgery. So an experienced surgeon who is well versed with the whole technology, whole method of doing a joint replacement, which we call as a traditional surgery. So in the traditional joint replacement, a surgeon is taking a predefined cuts with the help of a predefined instruments, okay, which is available, and then a surgeon decides that, okay, I am going to take cut this bone or shave off this bone in a particular way, and we are going to implant a new joint, okay, which a surgeon may be wrong or he may be right, but that error of 1 or 2% he cannot make out, because we are human beings, we cannot see that 1 or 2% error with our naked eyes. Then comes your computer navigation. Now this computer navigation is like a GPS, okay, a global positioning system. Now this computer navigation will tell the doctor, okay, you are taking that cut in a right or a wrong way, okay.
Right.
That 1 or 2% error will be taken care by the computer, but it is still the surgeon's hand which is going to make the cut. A computer is telling me that, okay, you are going wrong, but it's still my hand which is taking the cut, I can still do an error. So computer guide me, but it doesn't do the cut. Then comes your robotic, which is the latest technology. Now in this latest technology, it is guiding me, but there is a robotic arm. Okay, so the robotic arm is going to make the cut, so that 1-2% degree error will also not be there. The robot is going to cut, the robotic arm is going to take the cut, and because it's a machine, I have already told the machine I want this cut in this degrees. So the robot is going to cut perfectly in that degree, so there will not be any error of cutting. But having said that, now this is an old saying, garbage in, garbage out. A surgeon who doesn't know, if he is not experienced enough to do a joint replacement surgery, the robot is going to tell you after seeing the x-rays and the CT scan, okay, this patient needs this kind of joint replacement. But if I don't understand, I cannot say okay to that. If I say okay to that, robot is going to make the wrong surgery. So a surgeon has to be there, he has to okay the whole plan, and then we decide, okay, this is the whole thing, and then the robot is going to take those particular cuts. So progressing from traditional to computer navigation to robotic surgery, it has been all because of those 1 or 2 degrees error. So traditional surgeries are going on for last 70 years. That doesn't mean that they were wrong. People have been surviving after knee replacement. Their knee replacement surgeries have been going on for 25-30 years. That was nothing wrong. But we want to progress. We want to not do that 1 or 2 degree errors also. Maybe once a knee replacement surgery is done, it may last for 40 years. Because nowadays Joint replacement surgeries are also done in patients which are 30-35 years. Some decades back, 20-30 years back, joint replacement was made only for older population. When your life demands is less, we were doing joint replacement at an age of 70 years, 80 years, and we know life expectancy is, let's say, 100 years. So that joint will go on for 25 years. But nowadays we are doing joint replacement at 35 years of age. His whole life is there. And when you do joint replacement surgery at 35 years, your demand from life is there. You are not old that you just want a sedentary lifestyle, you want to go and play with your grandparents, you walk in the garden. You are 35, you have to support your family, you will be going to your office, you will be climbing a bus, you will be sitting in a taxi. So that 1 or 2 degrees of error should also be taken care, so that the longevity of the implant is there. So that's how the robotic joint replacement surgery help us out to take away of that 1-2 degree errors.
Right, so computer navigation and robotic surgery do not replace the expertise of the doctor.
Of course not, till now no.
Definitely. And I'm sure it'll never do, because you still need the expertise of the doctor and the sense of evidence-based medicine and correlating it clinically. It's amazing. You can never replace a surgeon.
I hope so. Let's see what comes out in next 20 years.
Definitely. And with these advanced technologies, like you said, doctor, it helped us minimize the risk and improve the outcome and longevity of
implant and the surgery.
Amazing. Now, moving on to regenerative medicine. It's trending now, and everyone's talking about PRP injections and their benefits. Tell us more about it, doctor, and who are the suitable candidates for such therapies?
So this is called as a biologics, and this is a regenerative medicine. Now, if it comes to surgery, now you can imagine, if it comes to surgery to me or to you, we will think 1,000 times before undergoing a knife. It's a human tendency. Nobody wants a surgery, and that's how we are looking for to non-surgical ways, and which is best. I always suggest all my patients, surgery should be the last resort for any kind of disease. You should try doing medication, physiotherapy, bracing, maybe take a walking aid. If nothing is helping, then only think about joint replacement surgeries. Now, these biologics and regenerative medicine, which is like a PRP, which is a platelet rich plasma therapy, and stem cell therapy. So what happens is, what is this platelet rich plasma therapy? We are harvesting your platelets. It belongs to the patient. We are harvesting the platelets from the patient's own body. It's a very simple technique, like one goes to give blood sample to the laboratory. With same type, we just take the blood in a syringe, and we put that blood in a machine, and we harvest the platelets. Now, because these platelets, these are of mesodermal origin, means they are genetically, and they can start wherever we are going to inject these platelets, they have a regenerating capability. So if there is a tendon injury, they will start forming the tenocytes, and a tendon repair phenomena will happen. If there is a cartilage injury, like wear and tear happening, we inject these platelets, and they will form a kind of a chondrocytes there, and new cartilage regeneration can happen there. So it totally now depends upon, first thing is, because it is taken from the patient. So if your platelets quality is not good, if the procedure, everything has been done very well, but the quality of the platelets which were harvested from the patient, they are not of good quality, they don't have that much regenerative capability, then of course the results will not be there. The second thing comes on how well the technique has been performed. Then it comes to the doctor and the surgeon who is doing this PRP therapy. Now, these are the latest technologies. Researches are still going on, and we cannot say with a full conclusion that okay, I am going to do a PRP therapy for this injury and the result will be 100%, because there are so many factors which are involved in giving a result.
Definitely.
Now, these things are more commonly have been used for sports injuries, like somebody who has a shoulder tendon injury, okay, a partial tendon injury, or a tendon which has become thickened, okay, because of continuous repetitive strain. Our body will start repairing that tendon, but it is not repairing. because of the repetitive strain. So what happens is the elasticity of the tendon goes away and the tendon becomes thickened there, and that muscle doesn't function properly. So it seems that it is helping the PRP therapy in all these kind of sports injuries. Even in early stages of arthritis, stage 1, stage 2 of arthritis, where there is not a full thickness loss is not there, and this PRP is supposed to start building up new chondrocytes and have a reparative phenomena also. So I will say these PRP and stem cell therapy helping more in sports injuries as well as in some amount of arthritis also.
Right, thank you very much for explaining it very thoroughly, Dr. Garg. It's much clearer now.
Thank you.
Now, if a patient has symptoms and they're complaining of joint pain, or they've tried something, or they've seen a doctor and their complaint isn't resolved, you practice at the Thumbay Institute of Orthopedics and
Definitely.
Joint Replacement, a leading center in orthopedic health.
Of course.
How does the patient journey look like there, and how can you help the patient who has a joint problem or unresolved concern?
So it's a very simple thing, and I think most of the hospitals, they follow the same protocol. Now it totally depends upon what sort of problems they have, Now we have a whole department of various specialized orthopedics doctors, and somebody who is specializing in spine, some doctors are specializing in hand surgery, somebody is specializing in knee, and somebody is specializing in trauma surgery. Now totally depends upon what kind of joint pain they have. When they approach to us, either they are taking an appointment on phone or through WhatsApp, or they are approaching directly to the front desk. So our front desk, they ask some questions, what kind of problems they have, and depending upon the joint involved, depending upon how the problem started, they are going to get an appointment for the concerned specialist. And then, having said that, they are going to approach to the doctor, and it's a multi-speciality hospital. We have all the tertiary care facilities here, MRI, CT scan, X-rays. So the doctor is going to evaluate you and have the requisite test, whether it can be a basic X-ray or an ultrasound or some blood test. The patient goes back, get the X-rays and all the tests done. They are called back by our staff that your reports are ready, and take a second opinion, second appointment. They come back to the doctor, and then we either we reach to a diagnosis with the basic test, or if they require a secondary more test like an MRI or a CT scan, we request for that. Having reached to a diagnosis, then we have a counseling room where we counsel the patients and their relatives what exactly the problem is. Like as I said, education is the key. So we try to educate all our patients with the help of bone models, with the help of animations we have, and let the patient understand what exactly the problem is. And then we give them the education about the various treatment options. So these are the various treatment. It's like a cafeteria choice, So we tell them, okay, it's your choice. Like you can go with the conservative management, you can have tea or you can have coffee, and if the problem is too severe, we decide, okay, conservative management is not going to help you, it has to be surgical. So we explain it to them that the surgery is very much required at this stage, and it's not an emergency surgery, and they can take their decision. They can come back to us for some more if they have queries and questions, and we always give them opportunity to have a second opinion, to discuss with other doctors whatever we have told them for any surgeries or undergoing any conservative management.
Right.
And if they feel free, if they feel comfortable, they come back to us for the treatment.
Amazing. It's a very thorough process, and
definitely
involves a multidisciplinary team, which is very impressive.
Definitely, because we have availability of all the doctors from all specialties throughout. So anytime anything is required, a patient coming to me for a joint replacement surgery, they have to be thoroughly examined. We cannot risk anybody. So joint replacement becomes secondary. First is patient safety. So we take a cardiology clearance, we take all other diseases, if he's diabetic, if he's hypertensive, all the clearances are done, and then only we proceed for our joint replacement surgeries.
Yeah, thank you very much, Dr. Garg. And lastly, if you can give our listeners a takeaway message about their joint health and mobility, what do you want them to take away from this discussion?
So what I will say is a balanced diet, balanced exercise, a balanced posture, and all these three combined will give you a healthy joint and a long-term mobility.
Amazing. So living in balance.
Yep. I think that's the key.
Yes, thank you, Dr. Garg. I mean, you've comprehensively outlined everything related to orthopedic health for our listeners, and that's very insightful. Thank you very much
Thanks
for
a
the
lot.
discussion.
Thank you.
And thank you very much to our listeners for watching us till the end. See you in the next episode.